Is it okay?
Yeah, sure.
You can see my slide right now?
Yeah.
So
Beautiful.
maybe rest of my talk, rest of the speakers will talk about maybe kind of the fractional laser or something like that. But today I will talk about the basics of laser powered microjet injection for the drug delivery. It's a quite different term and quite different new technology. So when you do the multiple injections, the classically manual injection has been popular used, but to reduce the manpower, to reduce the pain and the fear of needles, the many kinds of injection material has been produced, like the needle injection, the mesogun, or air or gas injector. So
good afternoon. I'm Dr. Seo. I'm a dermatologist from Seoul, South Korea. This is my first time to present in CyASIA, and thank you for inviting me to present. I'm going to talk about intradermal delivery of injectable PDLA with a novel needleless injector using laser-generated microjet. This diagram shows that what Dr. He already explained describes the mechanism by which microjet is created. Short high-power laser energy focused on one spot create an explosive force which allow the machine to expel the solution rapidly. The energy source is of YAG laser. The system supply and release solution in a constant direction through the check valve system. Before use, shake well to mix particle and solution homogeneously. Use 3 to 5 cc Rolox syringe and remove air inside. It is important to remove all air from the syringe and bottom chamber.
Thank you, Maja.
Yeah, thank you very much. And I heard a part of the presentations before, and I think it's a very involving issue, the drug delivery, because we want to put active substances into the skin. And the transdermal delivery does mean we want to have an alternative route to the oral or parenteral routes of therapy. We all know the patients don't want to take pills, and we know it is much more effective to have the substance live directly in the skin. And so we want to put these active substances into the skin. Before you are talking about transdermal delivery, you have to focus on your molecules you want to put into the skin.
Wow. Thank you so much for all my friends being here to work together. So in addition to the aesthetic dermatology, I also do pediatric dermatology. So it's a very good opportunity for me to combine both together. So today I would like to share the topical immunotherapy with SADBE, which is an immunostimulant, and we can use fractional CO2 to deliver and to enhance the reaction in treating wart. So I have no conflict of exposure, and everyone knows there's some topical sensitizer can be used in dermatology, and usually we treat alopecia areata and also verruca plana. So this will be enhanced the improvement if the kids cannot tolerate the pain from the laser or freezing.
So I'd like to talk about photodynamic therapy of very severe acne with the help of laser assisted drug delivery. So this is the pathology of acne. What I should emphasize. Can you hear me?
Yeah, actually, can you? 你可以分享的画面是你的脸，你可以换另外一个吗？ Could you try to share a different screen?
Oh, maybe. Okay, you cannot see my slide. Okay. Okay, is this right?
Not yet.
Not yet. Okay.
I can see. It works.
Is this right?
Is it right?
Yeah.
Oh yeah. Okay.
The right one.
Yeah.
Okay.
I think this is the right one. Yes.
Oh yes. Good. Good. Good.
So the major pathological manifestation of acne is the inflammation of sebaceous gland and hair follicles.
Hi, good evening, everybody. So my topic is something about some new drug that we try to push it in the hole. I do not have any conflict of interest for this talk. So I'm going to spend the next 10 minutes talking about two new medications that we've been trying to push into the hole. I'm going to tell you what is the idea and what are their efficacy. So these are two new drugs that we've been trying to put it into the hole. The first one is botulinum toxin, and the second one is tranexamic acid. So PAMA hyperhidrosis is one of a disease that we see in our practice. And so far, one of a treatment of choice is intradermal injection of botulinum toxin inside. But this treatment is very painful. And most of the time, we will need to do nerve blocks before we doing ID injection of toxin. By doing nerve block is also—
Yeah, Chang-Hun, so I'm quite curious about the delivery. So the way you are doing is how to increase the amount of the medicine or ingredient you like to deliver, make it more effective delivery. Is that correct?
So excuse me?
Yeah, I mean that the way you are doing is that to deliver higher volume of the medicine to enhance the treatment results, right? So that's
actually I the co-developed that kinds of device not to increase the amount, but to reduce the pain.
Okay.
Yeah.
Yes.
And then we would like to make a uniform injection without any fear over the needle.
Yes.